Okay, in the upper part here, so this is the oral cavity. We have the oropharynx right behind the oral cavity. Above it we have the nasopharynx, and then below it, starting here at the epiglottis, we have the laryngopharynx. We have the esophagus, and in this area we have the upper esophageal sphincter. The esophagus goes down. We have the lower esophageal sphincter in this area, also called cardiac sphincter. So it hits the stomach. So the region where the esophagus meets the stomach is called the cardia, and then the portion of the stomach that comes up like this is called the fundus. The rest of the stomach is called the body, and then the straightaway here, this narrowing, is called the pylorus, or the pyloric canal. The covering you see on the stomach is serosa. Okay, so this, you can see that the muscle is exposed, but the fourth layer on top of your digestive system is called serosa, if it's intraperitoneal. If it's retroperitoneal, it's called adventitia. And if you, so going back to the esophagus, right, we have those four layers, the mucosa, submucosa, muscularis externa, and then on the esophagus, it's adventitia is the last one because it's not covered with serosa. Anyways, so if we open up the stomach, you can see the rugae inside. You can also see the narrowing of the pyloric sphincter. So just beyond the pyloric sphincter, then we're in the duodenum. And the duodenum, the small intestine, has plicae circularis, so these ridges here indicating circular folds. You can see that the common bile duct comes down and meets the pancreatic duct. So here's your pancreas. The pancreatic duct is the lower portion. The upper branch is the accessory pancreatic duct that comes out higher. But here, this is what we would call the duodenal ampulla, or the ampulla evader. So in this area, and then outside we have a little duodenal papilla. Okay, so the papilla is present on the outside. The ampulla is inside this area where the bile and the pancreatic juice come together. If we want to look at the liver, so the liver has a right lobe, left lobe. The two lobes on the anterior surface is divided by the falciform ligament. On the inferior surface, we have a round ligament. This area where you see the portal vein, this is called the porta hepatis. That's right, porta hepatis. So there's three things in the porta hepatis. There's the there's the portal vein, the hepatic artery, and then the bile duct. So these three structures, there's branches of it at every corner of the hepatic lobule when you do the histology of it. Here we can see the right hepatic duct, the left hepatic duct. When they come together, it's the common hepatic duct. The gallbladder, the bile comes out from the cystic duct. Cystic and common hepatic come together to make common bile. So it's common bile. Okay, moving down to the intestines. Here's the spleen, right? So the small intestines, it's basically jejunum and ileum. The last portion of your small intestine is the ileum. And the ileum will meet the large intestine here at the cecum, and there's a valve, right? So this is called the ileocecal valve to prevent backflow into the small intestine. So here on the cecum, there is the appendix. Then from the cecum up, we have the ascending colon. We have a turn, so this is called the hepatic flexure, or it's also called the right colic flexure. It goes across, this is the transverse colon, and then you hit another turn, so this is called the splenic flexure, or it's called the left colic flexure. And then it goes down, descending colon. The sigmoid colon is not visible because it goes back, and then here, this is the up and down region, this is the rectum. So the rectum, you can see this large muscle around the anus, so this is the external anal sphincter there. In terms of other structures, you just want to know tenia coli. So this band of specialized longitudinal muscle is tenia coli. These are haustra, right? These puckered compartments. I don't think I put this down, but this is some mesentery right there. And is that it? I think this is good.